All right. Hey, what's going on? I know it's been a minute since I put anything up on the internet to help with medical education, but now that I have a little bit more free time and I was on the wards recently, and there was a topic that came up that I had to do some reading on, and I figured, well, what better way to know that I have an idea about it rather than to teach it here? So this video, like the title says, is I'm going to explain very quickly and very briefly what a contraction alkalosis is, okay? So first things first, what you need to know is that it is a metabolic alkalosis, all right? And just a quick review, no, this is certainly going to be in another video, but what do you need to know about that? So we have our pH here, right? Remember, so 7.35 to 7.45, anything lower than that, 7.35 is an acidosis. Anything greater than 7.45, right, is going to be an alkalosis, right? Acidosis, and I put B for base, but that's going to be our alkalosis. And then a quick way that I kind of like to think about it, all right, if you want to know is it respiratory versus metabolic, that's when you look at your CO2, and then you're going to look at your bicarb, right, and say that your PaCO2 is within normal limits, but your bicarb is abnormal, all right? And I know this is not great handwriting, but that's going to tip us off that it is, in fact, a metabolic alkalosis. All right, so let's go ahead and get into it. So really kind of the big picture of what a contraction alkalosis is. So it's a metabolic alkalosis that is caused by volume loss. So if you're on the wards, what kind of patient do you think you'd potentially see this in? Well, let's think about it. So you have a patient with congestive heart failure, all right? They have a lot of fluids. What do you give them, right? A diuretic. And then that fluid loss, or that contraction per se, is what's going to cause the metabolic alkalosis. Now, here's a quick explanation of kind of how this works, okay? So here, my excellent art skills. All right. This is going to be our nephron. All right. And then here's our stick figure. All right. So say this is our CHF patient. We give him a diuretic, right? So you get rid of volume. So our volume is now low. So what is the compensatory response when you have low volume, right? That activates the renin, angiotensin aldosterone system, which is going to lead to aldosterone being increased, right? So you get rid of volume, your body wants to get that volume back, so it's going to activate the renin, angiotensin aldosterone system. Okay, but what does this do to the nephron? So if aldosterone goes up, right, and your body wants to get more fluid, it's going to pull sodium back in, and then it will kick out potassium. All right, and you're maybe wondering, okay, what does that have to do exactly with the metabolic alkalosis? So one thing to note about potassium is that potassium is also an intracellular. So here's our cell, potassium is intracellular, right? And if you're getting rid of it, all right, hydrogen is then going to be moving into the cell to fill that loss of potassium, to fill that charge, okay? So if you have hydrogen going into the cell from the extracellular space, that is going to also make the extracellular space more basic. All right, so that's basically it. So all you need to remember is that a contraction alkalosis, it is a metabolic alkalosis that is caused from excessive extracellular fluid loss. All right, and if you want to see this in the wards, you want to think about it. If you have a patient who is in some way fluid overloaded, and maybe you're diuresing them, or you're trying to help the patient get rid of excess fluid. Hope that's helpful.